Hi, welcome. I'm really excited to talk to you today about an issue that's extremely important to me, access to care in veterinary medicine. I'm Dr. Elizabeth Berliner. I am the Director of Shelter Medicine at Cornell University and have spent quite a bit of my career working around this very issue. So thank you so much for allowing me to share this information. So if we're going to talk about challenges in access to care, how do our clients and our patients find us, and how are we able to serve them? We really need to understand a little bit more about demographics of companion animals in the US. And what I'm speaking about today is really centered, I'm really focusing on the US in terms of numbers and needs. So to get an idea of the scope or the spectrum, 2/3 of US households own a pet. 2/3 of the households on your street own a pet if they meet that demographic, that statistic. About a little over a third of households in the US own a dog. In terms of numbers, cats outnumber dogs a little bit in terms of the pet realm, but generally people have more than one cat, and many of them have many more than one cat. On average, in pet owning households in the US, people have 2.2 pets. And one big blip that is kind of interesting in the last couple of years is that backyard poultry is up. And so most of us aren't trained as pet chicken vets, but that is a real area of need that we have seen go up in the last decade. In general, over time, if you follow kind of the expenditures in the US, over time it has been increasing steadily, with a couple of blips that I'll talk about when I talk about the recession about a decade ago. And this is a really important statistic. Surveying pet owning households, 85% of dog owners consider their dog a family member. 75% of cat owners consider their cat a family member. And so these animals have an incredible role in families and are of incredible value, not just financially, because often that's not at all what we're looking for with pet animals, but emotionally, they are a part of the family. If we start looking at types of housing, where people live, 74% of people living in mobile homes own pets. 66% of households own pets. And then for renters, it really varies on where you're surveying. And so anywhere between 60 to 70% of people who are renting their homes own pets. And that's an important number, particularly when we start to talk about financial challenges, especially today. And then if we look at it by race or ethnicity, in surveying people in regards to their race, 65% of white respondents owned a pet, 62% of Latinx respondents owned a pet, and 37% of Black respondents owned a pet. And so there's definitely a difference in terms of the rate of pet ownership based on race and ethnicity in the US. So when we start to talk about access to vet care and how do all these pet owning households and these people find veterinary care for their pets, this is an incredibly complex issue. The challenge of talking about it in less than 10 minutes is a little overwhelming because there's so many factors at play and so many ways into this problem. So the most obvious one when you ask people is socioeconomics, right? So can people afford veterinary care for their animals? Can they afford healthcare for themselves? And I'm going to talk about each of these specifically. There's also challenges in the industry. So there are elements in the way that we have designed or evolved in veterinary practice that impact our clients and our patients' ability to access care. And that has to do not only with the cost of education and the cost of running a practice, but it also has to do with what's happened in our practice over time, meaning increased specialization, changing scope of care, expectations of clients, and even some of the legal challenges of being a veterinarian in what is a relatively litigious culture in the US. And then there's kind of this third window looking at, in terms of access to care, are people comfortable coming to the veterinarian? What are the cultural barriers, the language barriers, the geographic barriers in terms of care deserts, transportation, all the other ways that people practically access vet care? And I'm going to go into each of these realms a little bit more closely to try and pick apart what are the real issues. If you kind of survey people and say, what do you think are the socioeconomic challenges in accessing vet care? You get all kinds of terms kicked back at you. And again, I'm really trying to give you a broad overview. So I created this word cloud around the words that people gave me. So things including wage stagnation, which I'll talk about, recession, poverty, healthcare costs, unions, systemic racism, educational inequality, healthcare costs, gender gaps, big issues, big problems that we're not going to solve today. But all of these elements that are impacting our society impact our work and impact the way that we can impact families and pets. We do know that wage stagnation has been a huge problem in the US. So this is a study of the last 2 decades and a summary of a couple different national centers of statistics. But we do know wages in general up 10% in the last 20 years. And that has not kept up with some of the big costs that people experience in the US. In that same time window, college costs have gone up 31%, and healthcare costs and housing have gone up over 50%. And so the major expenditures that we have in our lives, the costs have vastly exceeded what we're actually making in wages overall. And so we have a widening gap of wage inequality in this country and income inequality. And you don't need me to tell you that. This is in the news all of the time, but it absolutely impacts all of those pet owning households and how they access vet care. And it impacts veterinarians in terms of not only their patients and their clients, but also their staff and their employees. If we start to look at socioeconomic factors directly related to pet owning households, you really have to think about the scope. So what do these big numbers mean in terms of the demographics that are represented? So there's a study that came out in 2018 that was put out from the Access to Vet Care Coalition. And it was a study that surveyed veterinarians and pet owners and pulled together a whole bunch of demographic information around access to care issues. And I have that reference for you at the end as well, because I think if you're working on this problem, you need to definitely look at that document. But it's important to realize that poverty in the US for a family of 4 is set at $24,600. I think we could all agree that that is an incredibly low amount of money to try to support a family of 4 in this country. And certainly there are urban settings that alter that based on cost of living in their area, but that is kind of your baseline. If you look at SNAP eligibility, which is the Nutrition Assistance Program or Food Stamps Program, which some of us know it better by, they work with a 138% poverty to consider families eligible for food stamps. If we take these statistics and apply them to pet ownership, it means that we have about 29 million pets that would qualify for a food stamp program, essentially meaning we have 29 pets that they're going to have problems accessing care, whether that care is veterinary care or perhaps even nutrition and basic support. There are probably many more unaccounted for, and do recognize that these figures were prior to the pandemic. And so a lot of these numbers we imagine will be greatly impacted by the economic crisis that we're currently experiencing in the US. In this study, the survey, they actually surveyed why did you not access care for different types of care, so preventive care, sick care, or emergency care. And they separated that out. And the vast majority of respondents, it was a financial barrier. They could not afford it. The second category was they didn't have a way to get there. And so transportation was a big part. And so between those two elements, those are barriers that we really need to investigate in terms of helping these pets and their clients. It also brought out this idea that we may want to look at different levels of care and decide which are the ones where we can intervene, which are the ones that are the best points of triage for different patients. I will also point out that we have a looming eviction. And so there's also a lot of concern these days in terms of what happens to those pets if their people are evicted. This is information that has come out since the pandemic. This was a November 2020 survey of adults living in the US. And at that point, 1 in 3 were reporting having trouble covering basic expenses like food, rent, mortgage, car payments, medical expenses, or student loans. Obviously, there have been a lot of programs to try and help here, but this is an important thing to keep in mind that with the pandemic, we're going to see these numbers increasing. And so this is such a timely problem. It is something we were talking about in the years before this all occurred. Obviously, that study came out in 2018, but it's definitely a situation that we now consider to be greatly exacerbated by the current situation. Do recognize too that there's also an element of access to care for unowned companion animals. So in the realm of shelter medicine, we have long also taken into account all those free roaming community cats that are loosely owned or don't have an owner at all through spay neuter programs, et cetera. Obviously, pet homelessness has been a problem in shelter medicine for years. Luckily, we've reduced euthanasia in shelters tremendously from 19 million animals a year down to less than 2 million animals a year in the last 2 decades. But pet homelessness continues to be a challenge. The other realm that has fallen to shelter medicine is kind of these population big events, disaster response, population health, outbreaks, et cetera. And I brought this up because there's lots of lessons from Katrina and other disasters that have taught us as a nation that pets are family members. And people will put themselves in danger. People will feed their pet before themselves. People will refuse to leave their homes in a crisis if they can't take their pets with them. And so we've learned over the past 2 decades, historically, that this is the case. And so we really need to consider in many of these families that the prospect of losing their pet can be a real emotional blow, can even be, I would argue, a public health crisis. So I've addressed some of the socioeconomic challenges. I'm going to move a little bit into the industry challenges around not only how we function as an industry, but also kind of what falls under the levels of care that we offer. So how we function as an industry today has been greatly impacted by what happened a little over a decade ago. So for those of you who are too young to remember, the country experienced a recession in 2007. And around that time window, we were also seeing a decline in the use of veterinary practice by owners, and there were declining patient visits. We were even starting to struggle with, had we trained too many veterinarians? Did we now have a supply of veterinarians and not a demand? And so there were some investigations done, and there's a 4-part Bayer veterinary usage study that surveyed veterinarians and owners and types of practice. And it's a very large study that I'm going to try to summarize super quickly. But really what they were looking at is, can companion animal practice withstand recessions? Will people keep coming? And also, kind of how the practice of veterinary medicine had become more fragmented. So with specialty practice or low-cost points of care, vaccine clinics, et cetera, had we essentially spread ourselves too thin? Certainly, we're also functioning in the day of Dr. Google, and lots of questions around how do we train veterinarians and what does the future look like? What they found in that study is that definitely the recession had contributed to a reduction, but that was already a trend. And so there were a lot of findings that came out that kind of impacted how we function in general practice or veterinary practice. The recommendations coming out of that study really focused on the fact that our costs are higher and we need to charge more for our services. And that in some cases, we need to specialize our services to meet a certain demographic or need. And so there's a lot of talk around building feline friendly or feline focused practices, continuing that trend of specialization, some elements around making sure we charge for each and every part of what we do and actually respect our education and respect our scope of skills by charging for that. And to some degree, building out even boutique sort of clinics, ones that really meet kind of that higher end client who is loyal and comes back and willing to invest a lot in their pet's care. And I certainly saw that in the last practice that I worked in before going into shelter medicine. We worked at a very high level of medicine. Our costs were very high. We were the most expensive in the city. And we had a lot of boutique services. We had cookies baking in the lobby and a cappuccino machine. And there was an element of really trying to meet that need as a way of making sure that we could be a sustainable veterinary practice and pay people appropriately. So I'm not necessarily against that approach, but there is an element to which we have essentially priced our way out of serving some of the population that needs us. And so I do think that there's a part of what came out of that study and that strategizing around the sustainability of practice that has impacted our ability to provide services to some of the other demographics not caught in that discussion. The other thing we know about our industry is that we have some issues with well-being in our veterinarians. And so there has been a decline in kind of the overall well-being of vets. This is a study that was done by Merck Animal Health. They did the original one in 2017 and then repeated it in 2020. What is important here is it was a survey of well-being among vets based on their age group. And not surprisingly, young vets find themselves at the highest point of stress and the lowest point of well-being. And essentially, your well-being improves over time, whether because that's an aspect of culture, meaning that the times have changed. And so people are more stressed depending on the window that they're in, or whether that's because as you age into the profession, you're more experienced and you get closer to retirement, you start to feel better about being a vet. Who knows? But the point is that our young veterinarians have high levels of debt and are very stressed by practice. And this study really revealed that. That we need to start paying attention to how we can support our veterinarians as they leave schools and move into practice in this younger 18 to 34, 35 to 44 age group. Another part of this, of course, is student debt. So student debt has increased over time. And this is probably the saddest thing to come out of, or the most disturbing thing to come out of that Merck study, is that 52% of veterinarians would not recommend a career in veterinary medicine who took that survey. They cite student debt as a main reason, and income not keeping up with that, so low incomes. And then stress is the third category, and a substantial category at 30%. And I do think some of that stress is probably related to those elements of debt and income and scheduling, but we know that that stress is also related to client relationships, challenging work balance, et cetera. And so if you started to look at the leading reasons, yes, debt and salary are high and stress is third, but there's an element here that I think captures some of the struggles we have with clients. And we don't really know what difficult or ungrateful means here, but certainly in my interactions with young veterinarians and veterinarians of any stage of their career, one of the biggest stresses I hear is that they are stressed by clients who can't afford services, or they are stressed by clients who deny services and they don't necessarily know why. They're stressed by clients they consider difficult, who argue with them or pick apart the estimate. And so what necessarily motivates that, you don't always know, but in many cases, I imagine it is true financial struggle. The other thing we know is, what do vets like most about their work? The respondents offered up invested, meaning I'm invested in my work and I take pride in doing a good job. So they want to be able to provide all those things that they were taught to do. They are often feeling like they need to provide all the things they were taught to do in veterinary school. And the second thing is their contribution, that my work makes a positive contribution to other people's lives. And that's the point where I say, this is where they really want to help serve people and pets. And we have a term for this. It's called moral stress or moral distress in veterinarians, meaning they know they have the ability to solve the problem to help that pet, but they can't because the client can't afford it, or they don't necessarily have access to that. Maybe they can't refer to the appropriate place that they want to refer to. And so there's this moral stress of knowing that you have the capacity to help the pet, but you necessarily can't do it today. And that comes up a lot, especially in shelter medicine, but I hear it from my general practice friends as well. So our industry challenges can be overwhelming too in terms of words, and I've tried to talk on a couple of those topics, but I also gave you kind of a word cloud of all the various elements. I didn't get to address social media and kind of the pressures involved there, some of the generational communication problems in veterinary practice, staffing shortages, lack of technicians, client expectations, the cost of training, cost of equipment, lots of things here that are real challenges when it comes to access to vet care. And so I tried to offer you a little brief look at some of the others I didn't get to talk about. And then in the last window, we look at barriers to our clients accessing us that are both systemic and a reflection of their challenges in society. And so if we start to talk about issues of diversity, equity, and inclusion, important to recognize that veterinarians, this is a surprise to no one, are primarily white. So these are statistics from the US Department of Labor in 2019. 1% of practicing veterinarians report themselves to be Black, 6.1% Asian, and 1.6% Latinx. And so certainly our profession is not representative of our culture as a whole. There is certainly a gender divide as well. So although women have been the majority in veterinary school classes since the 80s, if you start to look at positions of leadership or practice ownership, men are still the majority in that window. And so we definitely have some issues with gender divide. Socioeconomic and background educational levels of vets, we don't necessarily represent a broad socioeconomic spectrum, although certainly many veterinarians come from poverty or lower class backgrounds. Many come from more privileged settings. I think the unifying factor is they were all able to access education at a certain point to even get to veterinary school. And so we probably have, through one way or another, had privilege in order to access that education to get to veterinary school more than many of our clients. And then we've got challenges that veterinary services, we talk about deserts, so food deserts, where you can't access fresh groceries in certain parts of cities or urban rural areas. It's absolutely true for vet services as well. Redlining in cities, which impacted the development of businesses. In the 60s and the 70s, we see that with veterinary services. So there are many parts in cities, and we're just starting to really map this out for several of the studies. Many parts in cities where there is no veterinarian. You simply can't find one. And so in order to get to a vet, you actually have to travel across the city. Do you have transportation for that? Can you take pets on public transportation or not? Lots of challenges there. With rural areas, many places don't necessarily have the population to support a large veterinary clinic with a broad spectrum of care. And so we definitely have shortages in many of our rural areas. And then there are places like Native American lands where there may not be a veterinarian for 2 or 3 hours. And so people need to drive very far. And then, so just the distance is the problem, never mind all of the other issues. Language barriers are a problem for many veterinary practices. If they don't have bilingual employees, it can be a real challenge for a pet owner to then walk into a veterinary office and ask for help. And then in terms of cultural barriers, with all of these other aspects in terms of a lack of representation, the challenge of transportation, the language barriers, culturally, it can be a complete barrier to accessing veterinary care. If you've never been to a veterinarian, you don't know what to expect. That can be a relatively frightening proposition. If you're looking for help for your pet. So I wanted to include this too. This is from an article by Dr. Michelle Lim, who's a veterinarian in Canada, and someone who has looked at this access to care issue very closely. And this is a nested One Health model that she provided that kind of takes a look at all the environmental factors, the human factors, and the animal factors that need to be addressed or thought about in order to start to think about strategizing solutions. So this is a very broad sort of paintbrush. But I wanted to make sure that if there are elements I didn't hit on in my lecture, that you would also have this to think about, different ways in how these kind of big environmental systems impact right down to the very level of that animal walking into a vet clinic and getting service at a particular time of day, be that noon, which is fairly more easy to access, or midnight, when emergency services can be really hard to find. And so how do we find our way in? I have essentially given you this broad paintbrush of all the issues and problems that connect back to historical trends and socioeconomic challenges and recessions and all of these various kind of social challenges. How do we even begin? And believe me, there are days when I say to myself, where do I begin? But I think the important point is that there's so many ways in, and so many small important steps that can be taken to make this easier, and to start to find these solutions, whether those are technology bridges, financial systems to allow billing, or to find a way to make things more affordable over time. Challenges to capture data. Organizations need to capture data both in terms of the needs of their community and then also in terms of the services that they're delivering. And that data capture is not just about figuring out what works, but also in terms of proving the concept to funders, et cetera. We can look at points of healthcare delivery. How do we make things easier in that immediate moment? Supply chain efficiencies, huge problem for lower cost care and high volume care. So is there a way we can work around supply chain, its costs, short dated supplies, et cetera? Paraprofessionals. So veterinarians are super valuable. They cost a lot to make, and they cost a lot to employ. Is there a way to use their knowledge in a way that can spread out over paraprofessionals that can actually put their hands on animals and help increase service? There's a lot of work around case management and social services, including integrating social workers into these settings. and use it as well as language tools and systems to try and help with those interfaces with clients who may come from completely different backgrounds and have completely different struggles than the veterinarian in front of them. There's absolutely issues in veterinary training around finance, communication, and management. How do we train our veterinarians? It's hard enough to learn to be a veterinarian, the medical day-to-day. But additionally, we know that there's all these other factors that surround our ability to take our medical knowledge and put it into practice. Lots of work around practice models. So specialization can be good if we can figure out particular models that are more efficient and more cost effective. And this may involve volume. This may involve the kind of scope of care. What is it we actually do? And do we restrict that to particular types of cases, particular work? And then incremental care is an approach that really looks at, rather than a gold standard or no care, what are all the various points of intervention that a veterinarian can employ to help the animal, even if it may not be a perfect solution, the gold standard that you learned in vet school. There's an element of figuring out how to triage quickly and stratify needs. So wellness, sick, urgent care, they're very different types of needs, and they may be very different approaches depending on what your particular community needs. Incremental care models I already kind of described. You may stratify and triage your financial approach. So how do we figure out who really needs the most in terms of financial support? What sort of guidelines do we put into place? How do we employ different financing strategies for different levels of need, et cetera? In some cases, it may help to centralize services, single point of hotline or triage, allow smaller organizations to essentially dial into a bigger network so that you're not repeating and doing everything in your individual community. In other places, it may work to really set up smaller programs that are community collaborations based on what's already in that community. And then there's definitely the issue of sustainability, meaning you're making enough money to essentially sustain the operation while also realizing that philanthropy, at least in the US, plays a huge role. And we need to continue to nurture that and figure out what parts really need to be sustained on a day-to-day basis. And then how do we roll philanthropy into that in order to maximize what we can do? Do you know that there's already some efforts around this? So with the pandemic, this, as I said, this program, this need became really exacerbated and kind of rose to the surface across the nation. And so there is a large conglomerate collaboration called the HAS program, or Human Animal Support Services model, in which about 500 animal welfare professionals are engaged in trying to troubleshoot and problem solve this exact issue in a lot of different ways. There's over 30 working groups. I will say about 24 of these 500 are veterinarians, so it's a smaller subset. We've got people from all walks of life, social workers, lawyers, and all of that. And so there are people that are really engaged in this process. I think we're poised at a really important moment to figure out what are the best tools. And we've actually got a lot of players who can help test those tools and put them into play. And so I think this is a really important moment. I'm thrilled to be a part of the hackathon because I think this is really an important moment where if we can get some brilliant minds to come up with some tools, they could be quickly tested and applied and really proven in the actual work. So I hope I didn't overwhelm you. I hope you feel inspired that you can actually really do something. There's a way in. And there's a way to connect with other people who can quickly employ and trial things. So when I get overwhelmed, I always start with this quote: start where you are, use what you have, and do what you can, from Arthur Ashe, who was a tennis player. I know nothing about tennis, but I'm inspired nonetheless by his achievements. I included the references that I spoke to today in case you want to go back to any of those documents or take a peek at what's happening. Thank you very much for allowing me to speak with you this morning, and I look forward to seeing your ideas.